right, back here at halftime, and right now Lexington Catholic out to a big lead against Lexington Christian Academy. It's 46-29 here at Lexington Christian Academy, and joining us as we promised is Bluegrass Orthopaedics, fine doctor over there, and they got a lot of fine doctors, but this guy right here, Dr. McGonigle. Good to have you on again, man. I know we've been on here before with you, but how you doing right now, man?
Hanging in there. I appreciate you having me back on here, and I'm glad we've got some sports to watch here.
Yeah, we got basketball season underway tonight, the second night of basketball, but first official night for these two teams here this evening at the varsity level. So good to have basketball back on here in Central Kentucky. But let's talk about Bluegrass Orthopaedics once again. I know you guys just opened up a new facility right here on the end of Clay's Mill. Just you continue to evolve, continue to expand.
Yeah, well, we're really looking for as many opportunities as we can to serve the patients that we have the opportunity to take care of, and giving more and more options in locations both throughout Lexington and also expanding to other areas. I just opened up a satellite clinic down in London. I'm doing a couple days a week. We have providers that go up to Georgetown. So we're really trying to, increase our accessibility to people throughout the entire kind of Lexington area and out and beyond as well.
Absolutely. And then, of course, you guys serve, your big tagline is that you serve athletes of all ages. Each physician has a specialty. What do you specialize in for the folks out there that are just being introduced to you tonight?
Sure, yeah. So I'm what's called a sports medicine specialist. So it's kind of probably the most broad of the kind of orthopedic subspecialties. I kind of work on multiple areas through the body, but there's usually a focus more on a lot of things I do have kind of an arthroscopic component to them. But I see a lot of knees, a lot of hips, a lot of shoulders, a lot of things that are kind of don't involve joint replacement, but kind of involve fixing things like an ACL or a labral tear or a rotator cuff, that sort of stuff.
Well, we're here in basketball season finally. Football just wrapped up, but flipping the page to basketball, and what are some of the common injuries that we see out here on the basketball court?
Yeah, I think some of the most common things, think about ankle sprains. That's a real common one where people jump in landing, kind of rolling the feet. That's something that we see quite a bit. You do see some of the knee injuries. Unfortunately, every once in a while you get someone that tears an ACL if they land the wrong way, and that's a big point of emphasis for kind of strength training and conditioning to try to prevent those sort of things. And then you'll see some this is a physical game. Every once in a while, you see something like a concussion or something like that, but usually it's kind of restricted to more of the lower extremity stuff.
You got a lot of guys crossing over sports, going from football to basketball. What are some of the things that you would recommend for those guys that are switching over a sport so soon, because football had just wrapped up?
Yeah, well, the key is to really kind of try to build back into things. The area where sometimes people get in trouble is if you go from really not being used to playing a sport and then trying to go 100 miles an hour. And so having a chance to kind of build in and get used to the different conditioning, the different surface that you're going to be on, to try to avoid some of the overuse injuries, but also kind of not being in the appropriate kind of overall conditioning towards the end of like a practice or a game where those muscles are weak and fatigued. You might be more likely to do something like roll an ankle or have an injury from the muscle support being not as strong as it should be.
Bluegrass Orthopaedics, we had mentioned, you guys continue to grow. What are some of the things that BGO is doing to better serve the community in 2021? You guys have done a fantastic job, by the way, over the years serving the community, but I know you guys are continue to evolve that plan to put community first.
Well, I appreciate you saying that. We're kind of trying to focus in these times with still having a lot of the COVID restrictions, trying to see ways that we can kind of help with outreach and patient information. A couple of our surgeons, and I hope to be one of them soon, have done things like webinars to try to keep people informed. I kind of mentioned some of the different clinics we've had to try to reach other areas. We're kind of exciting. One of our other surgeons who specializes in joint replacements has brought in this specialized knee replacement, robotic-assisted replacement, which he's very excited about. We are as a group, and I think we're going to be getting more information out to the community to let people know what that is and how that works. And so I think there's lots of things. We're always trying to look to make sure we're on the cutting edge, and but doing things that are safe for patients too, and kind of bring that education and accessibility balance. So.
You know, you speak of cutting edge. You know, being the first in our community to have some of this high tech equipment. You know, I know you guys strive to be, you know, the leader in new technology, as you mentioned. Is there a learning curve whenever you have something like that? But I'm sure you guys go through extensive training on new equipment.
Yeah, that's a great question. Yeah, absolutely. I mean, anytime you're going to decide to do something different and change your practice, you want to make sure that you're as absolutely up to date and as, you know, get as much experience as you can on something like that before you make a change and do that sort of thing. You know, fortunately, we have the opportunity to do things for, you know, practice on cadavers and go to courses and wow. Get, you know, kind of hear from other experts around the country what their experience has been, you know, maybe what to look out for if there's going to be a bit of a learning curve or something like that. And so, you know, certainly by the time we get ready to practice it, we usually feel very, very comfortable that, you know, we kind of know the ins and outs and make sure we're doing the right thing.
Bluegrass Orthopaedics, Dr. McGonigle, man, I can't thank you guys enough for all the support that you guys, you know, show us here on PrepSpin. You know, we feel like we're a big part of the community, being able to share all these games, you know, with people virtually that can't make it to the game, and we certainly couldn't do that without BGO.
Well, I appreciate you guys having us and giving me a chance to talk to you. And like I said, I'm glad we got sports back. And yeah, as a sports medicine doctor, I don't like to be involved, but I like to watch. That's for sure. So thanks for having me.
We normally have a great game between these two here tonight, but LCA out with Tanner Walton not playing tonight. That certainly makes a big difference. But you know, when these two teams get together, it's always something special, even in a game that's 46-29.
Yeah, well, let's see. Maybe we'll get a little closer game towards the second half here.
All right, Dr. McGonigle, thank you so much, man.
Appreciate it.
All right. We'll have Jack Haynes joining us here in just a second. We'll bring you the third quarter. It's coming up next here on PrepSpin.